Hello, my name is d.hadaway, a founder of CallMyDokter. Thank you for joining me as I present an overview of a telemedicine platform we have developed in Indonesia. This presentation is for doctors considering on joining us. I have been in the consumer experience business for some 35 years and worked extensively in healthcare environments. Of this, around 15 years in Indonesia. My interest in telemedicine arose around 5 years ago when I was building community health clinics. Since returning to Indonesia in 2017, I have broadly been engaged with digital technologies and specifically on how to apply to Indonesian patient experiences. What is striking is many of today's experiences are about any doctor, but many in the community are looking for a higher quality engagement. History, secure video and records, online vitals, meaning my doctor is able to engage proactively in my health and wellness, and a newly defined quality consult through telemedicine is non-negotiable. Also joining me is Dr. Yunawati, our medical director. You may know her through her extensive hospital experiences. She is also actively involved in telemedicine in Indonesia. The presentation is designed for doctors wishing to explore our platform as support for their practice and providing their patients continuum of care, which you, the doctor, and the patient, anytime, anywhere. The journey over the next 10 minutes is to share a little more of who we are, our view of the future of telemedicine, and how we seek to support your doctor practice. If interested, we are happy to go into more detail on the financial arrangements, but do say these are competitive to existing sharing models for practices with what we believe are far better tools. I've largely gone through who we are, but we are a new venture in Indonesia where we obtained all our final licenses in July. In addition to myself, the developer of the technology, and Dr. Yunawati, we are also locally supported by Arya Setidharma. He is the ex-chairman of Astra's Sun and an avid investor in digital technologies. This includes Clue, the smart city solution in Indonesia. In the interest of the doctor, patient, and service provider, these players today operate largely independently. With modern technologies, desires and expectation of patients and doctors, a demand for better quality assessment, different ways to support chronic diseases, aged care, and the many interactions, these are demanding for different ways of treatment and monitoring. With COVID, telemedicine is no longer a choice, and globally we see most specialties changing the way they interact with patients online. My experience with health policies is that something like 80 to 90% of those are covering outpatient services and costs. This has the hospital-centered model under pressure, and over time, the 30,000 chat also seen as inadequate for many patients. Over the past 5 years, we have seen telemedicine evolve, and it is interesting to see which area it was being used for. From prescriptions to pre- and post-surgery, to caring for aging parents or a sick child, ongoing care for chronic care management, amongst any other areas. This is not inconsistent with today. However, we are seeing specialties finding new and more ways to engage. We then consider the gaps in today, the Indonesian landscape, due to the basic design of most telemedicine offerings here. This leaves a gap in the market for CallMyDokter. The objectives of connected care and patient experience are solving the continuum of care issue patients have dealt with for years. Better quality and tools, access and efficiency. Now with technology is about the ability to connect efficiently, receive a quality consult, and delivery of needed additional services, personalized and with my information and my history. This connectivity is a bit like a phone number. First mover advantage will matter. New patient journeys and experiences are emerging, looking for these interactions, as mentioned earlier. Chronic care, aged care, remote consults. Support for workplace health and safety is also changing with COVID-19, and generally an emerging role of a doctor around health planning and empathy. This leads us to considering the role of the platform as a service in supporting outpatient engagement. We'll of course see the service provider, the clinic or hospital, with its in-house medical record and reaching out to patients. A second model where the doctor clinic is also requiring support for scheduling, mobile platform with HIPAA quality secure video, and seamless access for referring services. This also can be supported with accounting, online scheduling, amongst other things. At the center of it all is the patient and their information, which leads us to the journeys we see emerging for the service provider and in-house doctors. We also see the home doctors also being possibly being the clinic doctors, being supported outside the clinic environment, but still respecting the need for the service provider and other service needs, the referrals, and seamless patient care. Fundamentally, it is about supporting the doctor in the engagement. Core medical information, scheduling, quality video, vitals, patient history, and seamless referrals. When you get the chance of walking through a CallMyDokter engagement, you will see the online engagement mirrors that of a clinic. It also comes with the SMS and email reminders and payment functions to make the journey complete. Our thoughts on vital monitoring is moving us to the next stage of support with patients and doctors. We recently identified and linked into an online monitoring opportunity which will see you through your mobile phone and provide patients see through their mobile phones, providing us medical grade reads of blood pressure, pulse, blood oxygen, stress, heart rate variations, amongst others. This takes us to the next level with monitoring opportunities on patients and employees without the many gadget devices needed for these vitals. And of course, it will be proactive support of patients' awareness of their own health. As a platform, we have a commitment to support building patient engagement, which we'll be doing through several activities: social media, opportunities around connected living, and targeting on corporate opportunities. We do believe that corporates will be seeing a different type of support. They require protocols, understanding employee health, are not more than ever tied to productivity, with workplace health and safety requiring medical judgments. For companies never engaged in medical support, a telemedicine platform provides an efficient support for management for proactive health and safety. To support understanding our platform, we support the doctors and patients with a series of user guides and videos, and will be conducting regular webcasts and Zoom training sessions. What's next? We're targeting a minimum of 100 doctors for a startup position, and we're expecting a lot more based on initial interest. As a pre-sign up, we'll have an expression of interest to either myself or Dr. Unawati. After that, we will hold webinars and direct discussions. As we head to startup, we will conduct an interview and confirm credentials, and then move to contracting and onboarding. I thank you for listening, and if you'd like to talk more through this and register your interest, please contact either myself or Dr. Yunilwati. Thank you.